coronavirus. It's a Q-tip that goes into the nose to get the sample. So it is important that this be cared for. Now, I would like to say that if you brush your teeth twice a day, that's very good. And I would like to see you do your nose flushes twice a day. So in order to get that ready to do, you can have salt and baking soda and a glass in your home, and some water that you've boiled or some distilled water. Now, you can also buy pre-made kits that can be used. But I'm going to show you what you do. If you're at home or if you're just traveling, what you can do is just add a half a teaspoon of salt and a pinch of baking soda. And you see I have those right here for you to see. Into a glass. And then you should use your distilled water and mix it. Or water that's been boiled for 3 to 5 minutes. And then you've got your solution. And you probably would want to warm the water. But I want to actually demonstrate for you that you can actually pour that in a hand, sit down your glass, and sniff it gently into the nose, let it drip, 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 and then blow gently. And do it about 3 times. And the 3rd time, and then change to the other side. Now I'm only cleaning the lower ridge or turbinate. Now I'm demonstrating that because I've taught this a long time, and it is not a procedure that if you have your makeup on you want to have to take it off. So this little bottle is even more handy because you can mix the salt and baking soda in it. That's a Neomed bottle. And if you will, when you squeeze it, it looks like a little fountain. So you would just take that into your nose and let it drip. And it won't destroy your makeup as well. And it's not as messy. So you can do that. They make the Neomed bottles and sell them at most drugstores, and they also have pre-packaged salt and baking soda. So if you want to make it simple, that's a little easier for you. I want to just mention, if you are allergic to iodine, be sure and get non-iodized salt. And then I would like to tell you some other things to do to protect yourself against the flu and other illnesses. In East Tennessee, we're very, very heavily green and with a lot of pollen on our trees. So because of that, it's the time of year that we will do this procedure just to stay well. Because if your nasal passages are aggravated or attacked by the pollens or other allergens, then they will swell and you'll have more mucus starting. It'll drain in the throat, you'll get a sore throat, and it'll just be a cascade of events that we just mentioned. So I'm going to want you to continue to use your nasal flushes to prevent getting sick, but if you should get sick, sore throat or an upper respiratory infection, it will also help to heal you. Now I have some things I want to share with you, which one of them is how to prevent and treat upper respiratory infections, and the second one is an upper respiratory illness protocol. And I have these available. I can make them available and attach to your video. But on the upper respiratory protocol, I just want to tell you that if you'll use the Simply Saline nose spray that's made by Arm & Hammer, and if you have the passages are being attacked, or if you feel you need to keep them cleaned out through the day, use it every 2 to 3 hours if you have symptoms. And then I would like to tell you that you should drink plenty of water. Recommend at least 4 of these 16.9 ounce bottles. And I'm not advertising for these companies, but you can do that or drink 8 glasses like your grandmother told you, getting in at least 64 ounces of water a day. I also wanted to tell you that Mucinex has a 600 milligram tablets that can be taken morning and night, or you can buy guaifenesin at much less cost at several different places, and they are 400 to 600 milligrams. Now, 400 is quite fine, and you can take it morning and night with all the water, and you will do well. And you will be able to get this medication for $1 or less. So, anyway, I also wanted to say that taking vitamin C and zinc is helpful, we believe, and I do believe heavily in your taking B complex vitamins. Super B is one that I recommend. Rest, sleeping at least 7 to 8 hours a night is extremely important at this time. Plenty of fluids, and wiping down your counters with a cleaner that kills viruses, and these oxygen cleaners do, and they're inexpensive. And the soaps should be not antibacterial, because the viruses that we're worrying about now are not bacteria, they are virals, and they don't always have antiviral. But this is just Dawn liquid, and the soaps are really very helpful. They will act as a surfactant to the covering of the virus, so that the virus will have it dissolved and it will be destroying the virus. You may say, well, how does the virus multiply? What does it do? It actually goes into this lining below the mucous membrane, whether it's in the lung or in the nasal passages, and it multiplies by taking off its coat and going into your cell and using your body's cell to replicate or multiply. And as it leaves, it actually takes part of your cell wall as its external wall. So let's all work together, fight to stay healthy, and drink plenty and take care of yourself.
God bless you.
Thank you now.